So the reason your LDL is going to go up is not because you're making more cholesterol, you're eating more cholesterol, the liver stops making cholesterol. It doesn't need cholesterol from the bloodstream, so it doesn't pick it up from the bloodstream, and hence the LDL goes up. Is the person who has low insulin, low triglycerides, high HDL, low inflammation markers, yet having a high LDL level, is the same as a person who has a high LDL level and has high sugars, insulin resistance, high triglycerides, low HDL? And I'd like to submit that they are two completely opposite people.
Mm-hmm.
A physician would agree that an uncontrolled type 1 diabetic is somebody who is at very high risk of heart disease. In fact, that's one of the highest risk. So a type 1 diabetic is somebody who's not making any insulin. And if they're not given exogenous insulin, their sugar levels go up. Their triglyceride levels go up. Their HDL levels go down. Would it surprise them that LDL levels are actually on the low side? And I can tell another easy example that people can relate to. If you take 100 diabetics age 50 years of age, and you weight match them with another 50 people who are not diabetic, who will have a higher LDL? So would it surprise you that the diabetic people will have a lower LDL and the non-diabetic people will have a higher LDL? And yet these diabetic people are at greater risk of getting heart disease. Okay, so we started out with a type 1 diabetic who is uncontrolled. I have several patients in my practice who came and said, I don't want to have an abnormal blood sugar. I'm going to go on a low carb lifestyle. I'm going to do intermittent fasting, and I'm going to have the same blood sugar that a normal person has. And believe it or not, even type 1 diabetics can achieve that goal. So when they achieve that goal, let's see what happens to them. Their sugars come down, their triglycerides come down, their HDL goes up, and their LDL rises dramatically. So then you have to ask yourself, hey, this person is maintaining normal sugars. They have excellent blood markers. Why are we blaming the LDL? Why would the body be so stupid and get everything normal and yet the LDL go up?